Hi, I'm Dr. Mark Williams. I'm Professor-in-Chief of the Division of Hospital Medicine at Northwestern University's Feinberg School of Medicine and Principal Investigator for Project Boost. I'm truly honored to submit a video for the Robert Wood Johnson Transitions to Better Care video competition. I'm very excited to tell you about a pioneering collaboration we've undertaken in the state of Illinois that includes the Illinois Hospital Association, Blue Cross Blue Shield of Illinois, and Feinberg School of Medicine at Northwestern University. We have a number of initiatives that have had dramatic impact on improving care for patients in the state of Illinois, especially as they transition from the hospital to home. This actually arises from work I undertook over 2 decades ago that was funded by the Robert Wood Johnson Foundation. Back in the early 1990s, the Robert Wood Johnson Foundation provided a grant to me and 2 of my colleagues, Dave Baker and Ruth Parker, for the Literacy in Healthcare study. Out of that, we have done a lot of work over the last 2 decades to improve care for patients, especially delivering patient-centered care that allows them to understand more about what healthcare providers are doing for them. So, let me tell you about what we've done here in Illinois. Through support from Blue Cross Blue Shield, we've been able to work with almost 50 hospitals in the state of Illinois to implement 3 different programs. First, we've implemented Project Boost, which is a national program known as Better Outcomes to Optimize Safe Transitions for Patients in collaboration with the Society of Hospital Medicine, where we've worked with hospitals to implement a toolkit that delivers patient-centered education and attention to them as they transition from the hospital to home. And as part of this, we focused on aftercare with nursing homes. A number of the hospitals with whom we have worked, in addition to implementing terrific teach-back programs that have increased patient satisfaction and understanding, have also reached out to the skilled nursing facilities in their communities and established relationships where they are better able to communicate with the care providers in the nursing home and communicate back to the hospital so that patients and their families are cared for along this continuum as they move from the hospital to the nursing home, and the care providers in the nursing home have a better idea of what happened in the hospital. Additionally, in Project Boost, as I mentioned, we've had terrific outcomes with teach-back education, and at one hospital, their patient satisfaction scores moved from about the 60th percentile up into the top decile rankings of patient satisfaction in the United States. In one of our premier programs, the Communication and Palliative Care program, we've reached out into the community and began to identify patients who would benefit from goals of care communication while they were still out in the community to prevent unnecessary hospitalizations. And then in another program, our Hospitalist Program Peak Performance initiative, we've worked with hospitalist programs at these facilities to improve their quality of care and done some unique projects around the transition from the hospital to the home. For example, one hospital was able to increase their show rate at post-hospital discharge appointments for patients. In other words, patients leaving the hospital after discharge and then following up at their primary care providers, their show rates at those appointments were about 42%. With a targeted intervention conducted as part of this Hospitalist Program Peak Performance initiative, they increased these follow-up rates of patients to 92%. Remarkable improvement that we think improved their care. And then we've been very excited about the project implementation in Illinois, as we've seen a 25% reduction in hospital readmissions when we compare this of units that implement Project Boost versus control units. So I hope you'll consider coming to Chicago and learning more about our preventing readmissions through effective partnerships that we've established, what we refer to as the PrEP program with Northwestern, Illinois Hospital Association, and Blue Cross Blue Shield to implement these 3 programs of Project Boost, the Hospitalist Program Peak Performance Initiative, and the unique Communication and Palliative Care program that focuses on training teams at hospitals in goals of care communication. We look forward to your thoughts.